question that was asked me today is, are there going to be any treatments in the future for my droopy eyelid? Such as, and I said, no, of course not. And I thought, no, 20 years' time, you never know. We might be having stem cell implants for droopy eyelid muscles that aren't working well. But at the moment, it's mainly have an assessment, have the measurements done, let your oculoplastic surgeon advise you what can be done, and then consider having some surgery. For droopy eyelids with excess skin, the operation is called eyelid surgery, upper eyelid blepharoplasty. After you've had an upper eyelid blepharoplasty, which is an operation done under local anaesthetic as a day case here at Clinical London, you will immediately have better vision because the excess skin will have been removed. And although, yes, you will have a little bit of bruising, a little bit of swelling and redness, you will see from hour one the improvement. And that will be sustained over many years once you've got rid of the small amount of bruising and swelling and once the stitches are removed. I also use tissue fibrin adhesive, which is a form of glue to reduce the number of stitches, and this makes your eyelid look a lot quieter after the surgery. And sometimes, even at 1 week, I get a very pleasant surprise when the patient walks back into my surgery and I cannot tell that they've had eyelid surgery because they just look so good. And they have a telltale smile on their face. Usually immediately after surgery, I will show the patient what their eyelids look by showing them a mirror so they can see the difference from immediately before the surgery to afterwards. And they will feel a lot better because after day one, they're going to have a little bit of swelling, things puff up, and I tell them not to worry during that period because by 10 to 21 days, the swelling will have gone, and by that time, they'll be feeling very good about their appearance. They will be able to see better because the droopy eyelid skin is no longer hanging down in front of their vision, and they will also look better for themselves when they look in the mirror, and for other people around them. They will see that their eyes look a lot more open, a lot more alert, less tired, less sleepy, and sometimes they've had an abnormal head posture like that because of the droopy eyelids. That will all be corrected as well. Droopy eyelid surgery with upper eyelid blepharoplasty has very good results. We estimate that at least 75 to 85% of patients will be exceedingly pleased with their surgery, and the remaining small percentage will eventually be pleased after the swelling has settled, and very few patients have to have any refinement procedures afterwards once the stitches are removed.